Dear colleagues, dear friends, my name is Miha Pirc, and in today's edition of Bringing Journal Back to Life from International Journal of Prosthodontics, it's my pleasure to present you a manuscript entitled With Quality of Life of Edentulous Patients with Single Mandibular Implants and Mandibular Overdentures using two different types of attachments. It's a manuscript that was and a study that was performed from our colleagues from Egypt, and when I read the title, and actually in general whenever we are talking about attachments and retention of prosthesis, a video like this comes to my mind. So in order to prevent all the laughter and funny moments during our birthday celebrations of our elderly, predominantly elderly patients, we have to think, what are the best attachments? So what's special about this study? Whenever we are thinking about restoring the lower jaw and giving a prosthesis supported by dental implants, we immediately, most of us at least, think of, okay, we need at least two implants. However, having one single implant is not something new. Our colleagues from Italy actually presented a case like that, as you can see in the video, already in 1997. It's a case report and a study later on, several studies that actually showed that satisfaction of patients and the stability is actually pretty similar to two dental implants. So with that in mind, colleagues from Egypt thought of, okay, so what are actually the best attachments? They recruited more than 80 patients, included them, placed 80 implants in 80 patients. Out of them, 71 survived, and then they were randomized to two different groups. First group, ball attachments, 34 patients. Second group, locators, 37 patients. So as you can see, both have similar properties, but however, they're different. And what they wanted to see is, with the standardized OHIP-19 questionnaire, check what are actually the benefits of both systems. So as you can see, functional limitations, fairly similar. Physical pain, fairly similar, and the others also fairly similar. However, if we look in detail, then we can see that there is actually one that showed a little bit of a difference, and this is social disability. What does it actually show? It just shows that patients that had ball attachments were more comfortable wearing this prosthesis, which means that probably retention was much better and they felt more comfortable, that it won't just fall out like from a charming lady in the video. So with this in mind, and also with another point which I haven't addressed and the authors presented well in the discussion, is that retention elements with locators had to be replaced slightly earlier than with ball attachments. And with all of this in mind, the authors concluded that the results of this study demonstrated that both actually work, that both are great. However, that after 6 months and 24 months, patients were slightly more happier with the ball attachments. So with that, I would like to thank you for your attention and the opportunity to present this wonderful manuscript, and restore well.